around when things are going to get better.
Louisiana Congressman Joseph Gao has introduced an amendment that would allow affected people to file mental health claims against BP's $20 billion liability fund. He says even as a politician, separated by several degrees, he has felt the toll and can only imagine what it's like for those directly impacted.
Every morning when I wake up, I feel this heavy weight on my shoulders, just thinking about the oil spill, just thinking about the thousands of people who are affected, and the hundreds of businesses that have closed, and the impact to the economy.
Gao says current law and the BP claims process do not cover mental health services. He's appealing to President Obama and the administrator of the BP fund, Kenneth Feinberg, to consider such claims. Feinberg's office would not specifically comment on whether they will do it, but in an interview he talked about the delicate balancing act.
I mean, you have to understand that on the one hand, you want to help as many people as possible with legitimate claims. On the other hand, you have to draw some lines, some line drawing, some equitable distinction. Now, where exactly I'll draw that line and under what circumstances, I can't say.
Now, the House Transportation and Infrastructure Committee adopted Representative Gao's amendment, and it now heads to the House floor. But even Gao admits, since this law was not in place at the time of the spill, there may be a legal challenge getting BP to pay mental health claims retroactively if they don't decide to do it on their own. But Gao believes these are legitimate claims that should ultimately be covered. Suzanne?
And Lisa, I understand that the state of Louisiana has asked BP specifically to set aside $10 million for a fund to deal with mental health issues. Where does that stand now? Yeah, they originally sent out their letter back in late May 28th. But the problem is that BP has been taking its time responding. The last response that we got, CNN asked BP, what's going on. And what BP told us is that they are currently still in discussions with all the stakeholders. Mental health experts in the state are saying, we don't have a lot of time on our hands, Suzanne. And are the churches doing anything to help with this tremendous need, the psychological need, the toll that it's taking on the parishioners? Yeah, just anecdotally, it's the churches, the nonprofit groups that are really filling this void here. There's a Catholic church, for instance, in Louisiana. They are adding more masses. They're seeing more people coming in. They're doing more outreach and counseling. And then later this week on Wednesday, there's a coalition of religious leaders that are going to be touring the Gulf area. And one of the key focuses is going to be on how they can get services to help people who are dealing with all this mental anguish and stress, Suzanne. Okay, Lisa, thank you so much. They need as much help as they can get. Members of Congress are on a holiday break from their jobs.